Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us. Going to be having a conversation with returning guest, Dr. Julie Harper. Welcome back to Health Professional Radio, Dr. Harper.
Thank you very much.
Well, for our listeners who may not be familiar with you, would you give us a little bit of insight into your background, your area of expertise, and what is it that you're doing now?
Absolutely. I have been a dermatologist in practice since the year 2000. I spent my first 7 years full-time faculty at the University of Alabama, Birmingham, treating patients for all kinds of different skin disease. In 2007, I started my own private practice. I've been in private practice now for an additional 13 years. During all of this time, I've really kind of honed my expertise in the areas of acne and rosacea. I'm the immediate past president of the American Acne and Rosacea Society. And because of that special interest in acne, I have had the opportunity to act as a consultant and work with our industry partners like Galderma, who are really out front with innovation for my acne and rosacea patients.
When we're talking about acne, is it a condition that is worsened in the winter months?
Well, I think acne is alive and well throughout the entire year. There are some people who feel like it worsens during the summer months, particularly people who live in hot, humid environments like Alabama. But there are some cases of acne that can also worsen in the winter. More often, though, what we would see in the winter is people who are using an acne treatment regimen. Sometimes those regimens contain topical medications that can be a little bit drying. And so if you live somewhere where you're going to be in a drier environment, or you're inside where we have heat and lower humidity, that's really more what we deal with in the winter months, is that we have to maybe adjust our treatment regimen just a little bit to deal with potential dry skin.
Many years ago, when you heard the word acne, you immediately associated it with teenagers. I haven't heard you mention teens once. Teens, acne is something that can affect anyone at any time. Is that correct?
That's right. It would be unusual to see acne in somebody younger than about the age of 6 or 7. And when we do, if you see acne in somebody between 3 to 6 or 7, we worry a little bit about that. So if you have somebody that you know or in your family that's of that age group, that person should probably be evaluated. But it's very normal to have acne from 7, really almost, it's unlimited. The upper age range of that is unlimited. I would still say we see it most commonly in adolescence, but I would take that adolescence number probably all the way up to 24 or 25. And then we know in our adult women in particular, we continue to see acne well into the adult years.
What causes acne?
Well, that's a great question. There are 4 main things that seem to work together to cause acne. One of those things is just underlying inflammation in the skin. Another thing is plugging up of the hair pore or the follicle. Also, sebum or oil in the skin plays an important role. And then lastly, bacteria. And the bacteria that's associated with acne is called Cutibacterium acnes. So those 4 things, and it's important that we know those 4 things because those are the 4 things that we're trying to target with our treatments.
Targeting those 4 things with your treatments, that's one thing. But during this time when we're having potential mask mandates, some mandates are actually already in place, how are these treatments going to be as effective with covering on the face that doesn't seem to be going away anytime soon? Yes.
What I would say about that is Maskne is real. I have certainly seen it in my clinical practice. So the first thing that I would tell people is that if you are experiencing breakouts under the mask, you're not alone. It is for real. But the second thing I would say is that mask is really important. We are going to be wearing these for a while. And so, if you're on a treatment plan for your acne, the best thing you can do right now is to not change it up a lot, but to become very, very diligent and consistent with that treatment plan. Some of our best treatments for acne, one of them would be something like a topical retinoid like a Cleef, which is triferritine, 0.005% cream. And that is a new retinoid, the first new retinoid in 20 years. And we are using that to treat acne, and we can use it to treat acne whether it's mask-related or not. We just want our patients to get on a good treatment regimen and then to remain very consistent with that.
What are some of the concerns that you've been hearing from your patients other than, some of the breathing issues that we've been hearing about concerning masks when it comes to the skincare, especially the treatment of acne?
Well, it's definitely, I would say mostly it is acne breakouts. There are a couple of other things you can get under that mask skin related, though. One would be something called perioral dermatitis, which may to a patient look like acne, but it's a little bit different. It's little fine, what we call micro bumps. They're teeny tiny and they're around the corners of the mouth. We don't really know what causes that, but it is something that we can treat in clinic. So if you've got even something like that, you need to see your dermatologist and let them know. You can also just see irritant contact dermatitis. You know, our skin is not used to being occluded like that for long periods of time, in particular around our mouth, where we continue to breathe, and then the moisture, even from our breath, turns around and gets trapped under that mask, and that skin stays damp and moist. And that can lead to just a dermatitis, which is an irritation in the skin, or it can lead to acne, or it could lead to that perioral dermatitis.
Have you heard of any effective treatments, maybe some home remedies from your patients?
Yeah, and I do think that's an excellent point. I would not, go out and try to find the mask that is made to prevent acne. I don't really know that really exists, to tell you the truth, but I think it's a great idea to regularly change your mask. Be sure you're wearing a clean mask, something that does maybe have a little breathability to it. But again, our top priority has to be that the mask is effective and safe and good at helping us to prevent the spread of the COVID virus. But if you can, using something that is a little more breathable, I think can help. But I would just say keep that thing clean, change them regularly, and then stay very consistent with your skincare routine.
When it comes to the stigma and the stress of dealing with acne on a daily basis, what have you been hearing from some of your patients, especially now when telehealth is all the rage? There's going to be lots of visibility with maybe other people when normally it might just be you and maybe your physician. Now there might be a couple of people involved.
That's a great question, and it's a question that is very near and dear to my heart. As somebody who treats acne, and quite frankly, as somebody who had acne as a teenager, acne really stinks. And I try to remind even other dermatologists when I'm speaking to them, how much acne on your face does it take to mess up your day a little bit? And most people, if they're honest, will say, it's like one lesion, one zit. It doesn't take much. And so we do want to be very, very aware of the stigma that goes with acne. And I would say that we see that right now. I'll talk about telehealth secondly. I would say right now, let's think about all of the virtual meetings we're having, even online school, Zoom calls. And so, maybe when you're in public, you have the opportunity to cover part of your face with a facial covering like a mask, but we're not doing that on these Zoom calls. And so much of our socializing now is done virtually. So I think it's very important that we do continue to treat acne as aggressively and effectively as we possibly can. When it comes to telehealth, we do see acne patients for telehealth, and it's actually been very, very helpful. Telemedicine in a dermatology practice doesn't work for everything, but it works really great for acne. And in particular, it's even been interesting, people can say, I've been using the white cream, the white cream you gave me, I've been using that on my face. And I don't always know what they're talking about. So I can say, hey, can you run to your bathroom and get the cream that you're talking about and then show me that? And so it's been interesting and helpful from that standpoint to be able to do telemedicine with acne patients.
Where can our listeners go and get some more information, some tips and recommendations for Maskne and seasonal acne and acne in general?
Well, always a good resource for patients with acne would be the American Academy of Dermatology. So that's www.aad.org. And that's always going to be a reputable resource for people with any dermatologic complaint. And another resource would be acleef.com.
Dr. Harper, always a pleasure speaking with you. I'm hoping we'll speak again soon.
And I thank you very much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with returning guest Dr. Julie Harper. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.